Sir, we made you as a host, sir. Kindly please share, sir.
Yeah. Can you see the screen now?
Yes, sir. Yes, sir.
Yes, sir.
Sorry. Okay, fine. So it's habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection in daily practice for the benefit of the individual and community being served. That's the definition from JAMA. You can see the reference there. So if you see the competency is defined as an observable ability. It integrates knowledge, skills, values, and attitude. So that's what comes the domains, the learning domains. So if you see, so when you define the outcomes, you'll see it falls under which domain. So that means to achieve the competency, it is a combination of these. So knowledge, skills, as well as emotion, values, and communication. That we call that affective domain. So three domains, competence. If somebody has a knowledge, if they do not have a skills, they do not have a third component, they're not competent. They have only knowledge. Vice versa. So it's a combination. The competency, the combination of integrating knowledge, skills, values, and attitude. Is that clear? Am I audible?
Yes, sir.
Yeah. So now, if you see the domains, the knowledge, when you talk about knowledge, the knowledge, for example, competency in context of respiratory function, that's a knowledge part. So respiratory function, first, to be a competent in respiratory care, nursing, first, the normal airway function, and then I should know about the airway abnormalities, etc., as a knowledge component. So when I have that knowledge, and then the skills goes there, the skills. So what skills there? Perform pulmonary function test. That goes to the skill, the next level. And communicate. Even if you see the domain of respiratory care competency, the healthcare provider is expected to communicate, educate the patient regarding airway obstruction effectively. That becomes communication. Again, a critical thinking, appropriately identify the high-risk patients, So all these domains, if you see, to be a competent respiratory care provider, you have these domains, knowledge, skills, communication, and, the critical thinking. So for all these things, you will have a specified outcomes to be achieved. So when you achieve all these outcomes, you become competent respiratory care provider. For that, the possible learning methods identified. So why I'm stressing on this? This is the fundamental for outcome-based education. If you could define the outcomes based on the competency domain, you will be able to identify the learning methods, the teaching learning methods, and then you will be able to identify the assessment method. This is what the next second step, if you see the constructive alignment, what we call. So what is fundamental here? Defining the outcome, what is expected in each domain. All these domain together forms competencies. For each domain, I need to define the outcomes. That's what the outcomes comes in. So when you define an outcome for each domain, you should be clearly defining the outcome. Once we define the outcome, it would be easy for us to identify the learning methods and the assessment methods. Is it clear? The competency domains, and then the how it is mapped with the how we will be using this to define the outcome. Is that clear? Shall I proceed further?
Yes, sir.
Yeah. So now, competence defines what a person is able to do well, effectively, following the professional standards. So that's how the hierarchy of learning. So when you see this learning outcomes, that's what you talk about the learning outcomes. Once you achieve these outcomes, the combination of these outcomes will lead to the competency. The next level, you will be able to achieve the goal. So the goal of the entire program is to create competent nurse to take care of the healthcare needs of the society, of the country, of the community, whatever you define. So that's a broad goal. To achieve that goal, you need to have these competencies. So how will you develop the competencies? By achieving certain outcomes. Is this concept clear?
Yes, sir.
Please stop me if anything to be discussed. Okay, fine. So next comes the objectives. The objectives are from the teacher's point of view. That's what now we need to come out of these objectives. We should start defining outcomes. The objectives are a statement in specific and measurable terms that describes what the learner will know or able to do as a result of engaging in a learning activity. So any learning activity, what is expected? You know, you could see that outcomes are from the learner's point of view, objectives are from the teacher's point of view. So you can why put the here and there. You know, the outcomes are the one what is expected at the end of the session. What is expected? So it should be measurable. It should be clearly defined. It should be you should be able to measure whether the outcomes has been achieved or not. So that's what the first step. If you see, there are different statements. Okay, can you let me know what is the first statement? Become the center of excellence in health professional education. Is this a goal or a outcome or a competency? What is it?
Goal.
Goal. Why do you say it's a goal? Very good. Why do you say it's a goal?
Because it is very broad.
Very broad, yes.
And it has a very higher purpose.
To achieve that, you need to have many steps. Good. What about the second one? Provide holistic nutritional care. The second one. Provide holistic nutritional care.
Competency.
Competency. Very good. Why do you say it's a competency?
It's more specific
Uh-huh.
to one aspect. Focus on one aspect.
So to provide holistic nutritional care, the student is expected to have knowledge, skills, as well as the affective part, isn't it? All three together.
Yes.
Okay.
Yes,
What
sir.
about the third one? Able to draw blood sample.
Competency.
Competency or outcome? What is it?
Outcome, sir.
Outcome is at the end of the session, student is able to draw the blood sample. So outcome भी है, competence भी दोनों हो सकते हैं.
Am I audible?
Yes, sir.
Yeah, please go ahead. Yeah. Suddenly, yeah. So able to draw blood sample. It's a
Outcome.
why do you say it's outcome? Very good. Why do you say? It's specific to one domain, isn't it?
Yes, sir.
Are you getting? Of course, you need to have knowledge, but this is specific to one domain. Fine. What about the fourth one? Demonstrate professional behavior.
It specifies attitude or value domain.
Domain, behavior, yes. To demonstrate professional behavior, you need to have the knowledge, skills, attitude, isn't it?
Yes.
What about the last one? Independent nurse practitioner. It's broader, isn't it?
So this touches all the three domains.
Exactly. So competency and as well as it's broader. So goal. You're getting, see, that's how we need to identify, when you look into the curriculum, if you could differentiate, then it is easy for us to plan our teaching, learning and assessment method. If you see, that's good observations. See, now that becomes the center of, that's a goal. And then you have your competency, and then you have, that's the outcome. And then the green ones, and the green one is our competency. The orange one is the goal, and the blue one is the outcome. You see the differentiate, specific to the domain. Understanding this will help us in designing our teaching, learning, as well as assessment methods. I'm trying to make it as simple as possible. Is that clear?
Yes, sir.
Fine. So now, if you see, this is what we see that, the roles, what is expected, the role of a, if you see the nurse practitioner, the goal is to be the competent nurse. That's on the top. For that, achieve that goal, we need to have define the roles. Some of the roles, they should be having that clinical care. They should be the leader of the team, and they should be they should have the effective communication skills. All these things, roles. The role based on the course and course-based competencies. That's what we call the course outcomes or the course competencies, and that leads to the roles. Once you achieve the roles, you achieve the competence, the final goal. That's how it is. You see how it comes. Now, if you see this pyramid, the first top, the university vision mission. If you see the university vision mission, and then on top of that, country's vision mission comes the university vision mission. Then comes to the faculty or college. Then comes to the program. You have MSc and BSc program. That's the program mission and the program goals. And then program outcome, course outcome, and then course unit and instructional outcomes. So this is the hierarchy if you keep it in mind. So where it starts from the vision and mission of the institute, and then it goes to the faculty mission, and then it goes to the program mission and the program goals and then comes program outcomes. So program outcomes, course outcomes, and then finally course unit instructional outcomes. That's what the mapping is. That's what in the introductory session, when I was listening to Dr. Sharda, she was referring to that. It's broad. If you understand, that's what whenever you go for it. Someone is talking. Hello? Am I audible?
Yes, sir, you're audible, sir.
In between someone not talking. Okay, fine. If you see this, what happens first at the beginning, it's all based on your institute's vision mission. So that is the fundamental starts. Once from the institute vision is done, and then you have your faculty or college, whatever you call, that is, and then it percolates to program mission, and then your program goal, what is defined with the program goal. From the program goal, you define the program outcome. This is the program outcome. To achieve this program outcome, we need to have certain courses. We need to have certain courses. That's what the course outcome. The course outcome. So the program outcome is decided by the need of the society, and that's what your council gives. That's the society need. That's what your council gives. To achieve this program outcomes, what are all the courses you need to have? And then you define the course outcomes. So these course outcomes are met by my daily class, what I'm doing, that instructional outcomes or specific learning outcomes. So that's how it is defined. That's what we need to understand, how these outcomes are defined. If you know this, it will be easy for you to plan your teaching, learning, and assessment methods. So now, once you understood this, and we need to understand the domains. Again, we'll go into the little depth of the domains. For the competency, as we learned, 3 domains: cognitive domain, psychomotor domain, affective domain. So cognitive domain is about knowledge, intellectual skills. It's all about the knowledge and intellectual skills. But the psychomotor, it talks about the skills, the hands-on. The affective is about attitude and values. A competent nurse should have all the 3 things. If someone is having a good knowledge and skills, if they do not have an attitude, they are not competent. That's how we need to have all these domains needs to be covered. The outcomes are defined for all these domains. So if you see the domains, that's what the Bloom's taxonomy comes in. So where the Bloom's taxonomy is focusing on the cognitive domain mainly, and where it comes in. If you see the cognitive domain, again, the cognitive domain having the hierarchy. The hierarchy, it starts from the remember. First, I want my student to remember the structure of heart. And then I want them to understand how the heart functions. And then I want them to apply the knowledge of heart functioning. When this valve is repair a problem, what happens? And then I want them to analyze. The next level is evaluate and create. So why this is important? The outcomes which we will be defining for your course program, even your specific learning outcomes, the module outcomes should be based on this level. Why this is important? At the end of my course, I want my students to remember. I want my students to remember the structure of heart. So if I say that, it's only at the remember level. So I will be using a simple teaching learning method. My assessment would be asking them to recollect. If I want them to understand, so I will be going into the next level of teaching learning. I will be explaining. I will be explaining to them. I'll be explaining to them, and I will ask them to explain. I will ask them to write an essay, short essay or something. If I want to go them to apply, I will explain the heart function with proper drawing and the animations. And then I will expect them to apply. I will assess them using higher level assessments. Like, again, a structured essay or an MCQ at the level of applying. So that's what important for us to understand this, because our teaching, learning and our assessment is purely based on the outcomes, what we are defining. That's what the terms where you will find elsewhere, you see these are all the terms used, for knowledge. If you want them to define, it's at the low level, remembering level, and then you go to summarize or interpret or classify is at the higher level, apply is the third level, and then that keeps going. That's the hierarchy of learning. So your daily outcome is based on that. When you progress further, you'll understand if your course outcome is not only at the knowledge level, you are expecting at the the remembering level, you are teaching only at the low level, and your assessment also will be at the low level. That's what defining the outcome. So the other domains also are defined. The psychomotor domain, if you see, first observe, the learner observes, and then the learner imitates. Then we are expecting the learner to perform under supervision. Then we are expecting the learner to perform independently. The top level, the learner perform with high degree of proficiency. That's how the hierarchy. So again, if your outcome is at the end of the session, my student will imitate this procedure. So that's at the second level. But you're telling the student, expecting the learner to perform under the supervision. Then your teaching method is different. Your assessment method is different. If you want your students to perform independently, method is different. Allow them to practice and supervise them, give them the feedback, and then ask them to perform independently, and then you mark them. And then you provide them the feedback. The last one is with high degree proficiency. That's what they meet all their outcomes, and then they become competent, especially when it comes to the skills. So that's the hierarchy level for the psychomotor. So you will define your outcomes based on the level also, what is expected out of them. So once you define the outcome, it becomes easy for the learners what is expected out of them. It is easy for the teachers to plan the teaching learning methods and assessment method. That's what the defining is important. You see, imitation, copy action of another, observe, replicate, and then manipulate, precision, articulation, utilization. That's how the different levels of psychomotor domain. Similar way for affective domain, a simple way, the learner receives, and then we expect the learner to respond. Then finally, that become internalization. They internalize themselves. So they receive, they respond, and finally they internalize themselves. That is what the affective domain. Again, we will define the outcomes based on the level. So that's domains. If you see again, receive, respond, value, organize, characterize. So the respond, showing some new behavior as a result of experience. That's responding. Valuing, that is showing some definite involvement or commitment. That's how the hierarchy. So these are the verbs. If you see, this is available elsewhere. If you want the students to at the level of responding level, you will ask them to follow the instructions and follow the procedure. So that's how we define the outcomes based on this level. So the levels, understanding the levels are very important for us to defining the outcomes. So the other one, what we need to understand in the healthcare, health professional education is the Miller's pyramid. So this is how we expect the students develop their competence. First, we expect the students to know, and then they move on to knows how, they shows how, and does. That's the hierarchy. So why this is important? That's how the hierarchy. You see, the nose is fact gathering. That's just the knowledge. What we are assessing is given there. It's assessing is by the traditional true or false or MCQs. And then the knows how, what we expect them to interpret, we expect them to apply. And then shows how, way that we expect them to demonstrate. We expect them to demonstrate. The last one is does. So they perform, they integrate, they perform. That's how the Miller's pyramid, attitude, skills, and knowledge. If we could see the difference, please, we need to start using Miller's pyramid, because it's not only Bloom's taxonomy, it's about that. Healthcare, health professional education is more than that. So Miller's pyramid, knows how, shows, does. Is that clear so far? Is that clear? Are you all there?
Yes, sir.
Yes, sir.
Are you all using this in your daily teaching practice? Can someone give me some example where are you using this? Are you all using this in your practice?
The clinical setting.
Are you all there?
Yes, sir.
Yes, sir.
So you're using only in the clinical setting. Can someone give me some example where are you using this? I think it's echoing. Okay.
Then OSCE sessions, we sometimes check this one out. Knowledge, skill. Skill we see in the OSCE.
Good, good. So not only Oski, very good. Not only Oski, when you plan your teaching sessions, also we should stick with this. When you define your outcome, what I expect from the learner, what is the outcome at the end of the session? I just want them to know. Then my teaching method is different. If I want them to apply, my teaching method is different. Knows how. That's very important. That's what the defining the outcomes becomes important for us. So that's how if you see these two. The knows how and knows, it's for the cognition level, and then we have does and shows how, that is for the behavior. When we say behavior, it's a combination of skills as well as your affective part. That's how the Miller's pyramid. Knows. The best. That's the base. The learner knows. You see the epidemiology, signs and symptoms, pathophysiology, and treatment of congestive heart failure. That's only knows. If you see the knows how the students utilize the history and physical exam, the diagnostic test to diagnose and stage congestive heart failure. You see the difference. And then it shows how. The learner shows how to develop and implement a treatment plan for a patient on congestive heart failure. Does. The learner demonstrates the ability to evaluate the post-treatment status. See, that's how when we can define our outcomes based on this, it becomes clear to the learners as well as for you to plan your teaching, learning, and assessment method. You see the last one, the learner knows the indications, contraindications, and risks associated with placement of chest tube. That's knows. Knows how the learner knows to place a chest tube. Knows to place. But the third one is he shows how. The learner shows how to place a chest tube. The last one, the learner does the procedure of the chest tube placement and implement the post-procedure care. They go to the next level. Is that clear? So now my question to you, if you want your learner to do the first level, the learner knows indications and contraindications. So how will you plan your teaching methodology for this? Which teaching learning method will you adopt? Which teaching learning method will you adopt?
Can be a team-based learning, sir.
Okay, team-based learning, fine. Why it's team-based? It's just a basic level. Why team-based? I want my learners to know.
The fundamental concepts they need to understand.
Yeah.
The small group discussion.
Small group, okay. What about a lecture method?
Lecture come discussion. Demonstration.
Yeah. So, okay, what about to the next level? Learners knows to place the chest tube.
Demonstration and written demonstration.
Demonstration, okay. Okay, then what about the third one? Learner shows how to place the chest tube.
Written demonstration.
They need to demonstrate on a model, isn't it? Simulation, yes?
Yes.
Yeah. So what about the last one?
Demonstration and written demonstration.
Demonstration, okay. Okay, then what about the third one? Learner shows how to place the chest tube.
Written demonstration.
They need to demonstrate on a model, isn't it? Simulation, yes? Yes. What about the last one?
Demonstration and written demonstration.
Demonstration.
Real life setting.
Okay, real life setting. Good. So now, the same way, if you define this outcomes very clearly, you will be able to plan your teaching learning method as well as your assessment methods. Now you go back to the same. How can we assess the first one? How can I assess whether my learner knows the indications and contraindications? How can we assess this?
Maybe a viva or a question answer test.
Yes.
Excellent. Excellent. Very good. What about this? The second one, knows how. How we will assess? How can you assess this?
OSCE method.
Test
also can be done.
Yes? OSCE?
Yes, sir. OSCE and OSPE.
Then what about the third one? Shows how. Learner shows how to place the chest tube.
That is on the simulator.
Demonstration.
Demonstrate on the simulator.
Using a performance checklist.
What is the difference between the second one and the third one? Second one, you said we are
Practical
discussing-
exams. Practicals.
So what is the difference between the second one and the third one? Those
One is cognitive and the third one is behavior.
third one is more psychomotor, isn't it? Behavior. So there we will introduce our OSCEs and OSCEs. That's what the defining the outcomes becomes very important. Yes. So that's what the defining outcomes becomes important. That's at the fundamental. You know why? We need to define the outcomes. Fine. So if you define the outcome based on the levels, it's easy for us. So now you see, these are all the levels of outcomes. What do you think the first one? A competent nurse. It's very broad, isn't it? You see, when it goes down, the third one you see, so that the competent nurse applies the knowledge in identifying and managing impairments, functional limitation, body restrictions of various health disorders. It's very broad. It's very broad. And then the second level you see, demonstrate acquisition and integration of nursing knowledge, principles and practices in common clinical context. Third one you see, the demonstrate nursing assessment management of clients with psychiatric disorders. Demonstrate nursing assessment of pressure ulcer. Then the last one you see, describe anatomy of heart, perform auscultation to identify abnormal breath sounds, measure blood pressure. So what is your understanding by seeing these different colors? What do you see maybe we'll go from down. The last one, what do you think?
That is the unit objectives,
Excellent.
instructional
Outcomes.
objectives.
Yeah. Very good. Fine. Good. Fine. So when you can build on, based on, this is a unit or a specific learning outcome. This is the module outcome. One module, pressure ulcer. And this becomes a course outcome, an assessment and management of psychiatric disorder, a course outcome. And then you become a program outcome. This is the program outcome. And then program specific outcome. That's how it is defined. Now you'll understand that. That's what the defining outcomes, different levels. You see, start from the top, the pink one, the first one. Program specific outcome. A competent nurse, a healthcare professional who are leaders, a competent healthcare professional, leaders in nursing practice. So that takes some years for them to achieve after the program. They will not become a leader immediately after the program. So that takes some years. So that's what we call program specific outcome. It takes some years. The second one will be able to demonstrate critical thinking skills to diagnose and manage people with medical disorders. If you see that, that becomes a program outcome. Nursing care, providing nursing care. That program, when completing the program, we expect them to achieve all those things. To achieve that program, we'll have many courses. So one of the course, next comes the course learning outcome. The course learning outcome will be able to design a management protocol for patients with respiratory disorders. Patients, those who are admitted in the ICU. So that becomes the critical care course, the course learning outcome. So that is when completing the course. The base level is the specific learning outcome. That is your daily class. Will be able to demonstrate BP measurement in a model accurately. That becomes the specific learning outcome. That is when completing the module or when completing the topic. That's how the hierarchy. So when we define the outcome, we define based on the level. At which level I want. Knows how, shows how. That's Miller's pyramid level. And then that is again which level of the, whether it's a program outcome, I want that the outcomes to be achieved by the end of the program. When I say program, by the end of 3 years. And then by the end of the course, when the course completes, the subject completes, and then specific learning outcome by the end of that particular session or by the end of that particular module. That becomes that, daily the specific learning outcome. Is that clear? Levels of outcomes?
Sir, can I ask a question?
Please go ahead.
Sir, now when we are designing it in form of program outcome, course outcomes, is it also necessary to know the must know and desirable to know when we are making, or is it based on each course outcome or unit out?
Yeah, when we move away from this traditional curriculum, when we define the outcome, we expect the students to achieve all the outcomes. That means must. We expect them to achieve all the outcomes.
Thank you, sir.
Am I clear?
Yes, sir.
Fine. So, any clarifications here? That's good. We always have these kind of doubts. The must to know, good to know, nice to know. Those were the earlier one. When we define the outcome, we see that all the students. That's what in the definitions we saw that we want our students to achieve all the outcomes. That's what the outcome-based education talks about. We focus on the outcomes which are must, which is mandatory to practice to provide nursing care. Those outcomes needs to be achieved. If someone didn't achieve that outcome, they are not qualifying to be a nurse practitioner. Yeah. And any clarifications here? Is that clear? Is that clear?
Yes, sir.
Yes, sir.
Okay. So why to define program learning outcomes? That's very important. We were wondering earlier, it was not, given much importance. Why should we define program learning outcomes? For all the stakeholders, if you see for all the stakeholders, it's very useful. The learners, they know what is expected out of them. They will be able to select which program they would like to join. And then they will be able to identify their own strength, weakness, and progress if they know the outcome. I achieved this outcome or I didn't achieve the outcome. Even for the teachers, as we discussed, it's very easy for teachers to plan the teaching learning method, evaluate and improve the curriculum. We can also measure the impact. What is the impact? Even for the institution level, the achievement across the programs can be evaluated. It also supports the transparency, accountability. We'll be able to align the teaching and learning with the overall mission. That's what the outcome analysis is expected. When you go for this accreditation or why the outcome analysis is expected is that, how we meet the outcomes, how that is again mapped with your institutional vision and mission. That's what defining the outcomes becomes very important. So again, whatever we learn, you see the goals are broad statement. Objectives are the teacher or course instructor's expectations. Outcomes are specific statements that the student should be able to do after completion of the course. I try to put an example there. You see, this program will provide an overview about the musculoskeletal anatomy. That's very broad, the goal. At the end of the course, the learners will be able to describe the musculoskeletal anatomy. That's my objective. It's broad. My objective, of course, it is measurable. It's the objective from the teacher side. When you see that outcome, at the end of the course, the students will be able to list the muscles of upper and lower limbs, describe the attachments of the upper and lower limb muscles, specific. So when this is so specific, it is easy for the learners what is expected out of them. Their learning will be more focused towards that. You can also plan, I want my students to only list the muscles. I just want them to describe the attachments. So your teaching plan will be very easy and you will adopt the right method. You will adopt the right assessment. The learner also knows what is expected out of them. So they will be able to focus very clearly. That's outcome. So we need to move from objective based to outcome based. Is that clear? Any clarifications, any points to be discussed? Anything to be discussed?
No, sir.
Fine. Okay. So now the program learning outcomes will be mapped with the defined goals first. When you define the program outcome. I think somebody raised the hand. Please go ahead, Dr. Shailesh. Dr. Shailesh, please go ahead. Fine. Okay. So the program learning outcomes needs to be mapped with the defined goals. If you see the goals, if you see the roles are there on the top, you'll see the clinical care, communication, member of a disciplinary care, and ethics and accountability. You see all the levels, So that is mapped again the program outcome. That's what we define the PO1, PO2, PO3, PO4. Acquire and apply the knowledge, skills, and attitudes required to provide nursing care. That's a clinical care that's mapped. Demonstrate comprehensive clinical expertise in nursing. That's a program outcome, and that is again mapped with the clinical. Identify, formulate, and provide creative, innovative, and effective nursing care for people with various disorders. That's again a clinical care. And then you see the program outcome 4, that is communicate effectively. That goes with the communication. The program outcomes are mapped with the roles and what is defined. PO5, PO6, PO7, you see how that is mapped. That's what the first level of mapping. So when you map this, you are achieving the roles and goals, what is defined. So that's the first step we define. When you define your program outcomes, you see that it is mapped with your expected roles and goals. That's how we map the first level. Is it clear? Is that clear?
Yes, sir.
Fine. Okay. That's a different, I'm just talking to the laptop. So if someone responds, that's fine. And then once you define the program outcomes, you go to the course outcome. The course outcomes are mapped with the Bloom's taxonomy or Miller's pyramid, which states the major skills, knowledge, and attitude that the student will acquire through the course, which is always expressed in terms of measurable and observable behavior. That's mapped with the Miller's pyramid and Bloom's taxonomy. The map with the learning domains. Knows how, shows how, what is expected, what you are expecting. And then this is another, one of the example course outcomes from our course what we recently developed. This is one of the course for people, those who are assisting the orthopedic surgeons, orthopedic technologists. At the end of the course, the students identify the complications associated with the common fractures, dislocations of upper limb. That's purely knowledge based. Just a knows how level. And then you see the second outcome, assist the orthopedicians in the management of fractures and dislocations of upper limb by reduction of by reduction and splintage. So we are expecting them to assist, shows how, assist the surgeon as a first or second assistant by using accepted surgical practices and techniques. Again, that goes back to the shows up, because that's the level we define. So that's the course outcome. So this course outcome will be mapped with the program outcome where they assist orthopedic surgeons in the procedures. That's one of the program outcome that becomes under the clinical care. That program outcome is mapped under clinical care. So for that program outcome, we have 4 or 5 courses we may have. For that, one of the courses does. So this is how we define the course outcome. The course outcome is mapped with the level. Miller's pyramid, when you go with the level. I should be very clear when we define the course, which level I want. I want them to know how. That's purely a theoretical application level. I want them to show how. I want them to perform independently what I am defining. That's your course outcome. So this course outcome will be mapped with the program outcome. Earlier we saw the program outcome is mapped already with the roles and goals. Is that clear? Course outcomes?
Yes, sir.
So now when you see, again, if you see the course outcome, if you see by the end of the anatomy course, the students will be able to list all of the muscles of upper and lower limbs. I want them only list, the action verb. See the action verb. The list is only at the nose level. It's not nose how, nose level. Okay, the condition is all the muscles. So upper and lower limb. So what is the level? It's a very low level, cognitive level 1. So that's my course outcome. So my course outcome is the low level there. So when this course is taught at the basic level, it's not expecting me to go to the higher level. So all my teaching methods and assessment methods will be at the level of cognitive, at the C1 level. Is that clear? Are you able to follow?
Yes, sir.
Yes, sir. Yes, sir.
The next one, by the end of the course, the students will be able to diagnose learning disabilities in elementary school level settings. I want them to diagnose. So that goes to the level of knows how. Analysis level, higher level, it goes to the higher level. And you see the third example from another course. By the end of this course, the students will be able to apply the basic biomechanics knowledge in assessing musculoskeletal problems. That goes to the apply level, again knows how. All these things are for the cognitive domain. So these 3 course outcomes predominantly focusing on the knowledge aspect. There is no psychomotor involved here. So again, that goes to the C3 level, that's the application level. So which level knows how, and then you can also go with the Bloom's taxonomy level. So your course outcomes decides what level is that, which level what you are looking for. So usually for the basic level courses, the first year, the first semester, we'll start with the nose, and then we goes to knows how, and then slowly we build up them to shows how, and then finally when they come to final year and the internship, we go to that level of does. So that's how even the program outcomes or the course outcomes are defined and mapped. And then we go to the specific learning outcome. That is again the specific learning outcomes of every module or your daily class. So that is again mapped with the Bloom's taxonomy or Miller's pyramid. What it does, it says the specific skills, knowledge, and attitudes you will acquire through the specific session. After today's session, what you will be doing. This is also expressed in terms of measurable and observable behavior. So once we define this learning outcome, we will go for this. For this particular learning outcome, what content is required, what learning activity is required. Am I going to give a didactic lecture, or I'm going to facilitate group discussion, or I'm going to demonstrate? I decide that learning activity, and then I decide the assessment. That's what defining the outcomes are important. So like how we define the program outcomes and course outcomes, just we saw, that is a broader level that is mapped. But which is important for your daily teaching practice is defining your specific learning outcomes. We just thought, we could apply this ABCD of learning outcome. So A stands for audience. Who? And the who is your audience? Who? And then B, behavior, that action verb, what we are using, that decides the level. That decides the level, and that decides the domain also. And then you have conditions. Under which conditions? And then you have the degree. Which standard? So that's how we define the specific learning outcomes, especially when you use it for your daily teaching. Fine. So these are all the examples. The participants should be able to write learning outcomes in a given worksheet correctly. For that correctly, I will have a rubric, I will have a checklist. So A is the participant, that's audience. Right is the behavior, and then in a given worksheet is the condition, correctly is the degree, using that the rubrics. That's how I define the learning outcome. So when this learning outcome is defined, I can clearly say now what type of teaching method I will choose, and what type of assessment method I will choose for that, so that I can see the learning outcomes are met. The final year physiotherapy student should be able to perform passive shoulder mobilization in a given model accurately. Again, for accurately, I will have a checklist. I will have a rubric when I say the degree. So the audience, A is physiotherapy, final year physiotherapy student. The B is perform, B that's a behavior. And the C is in a given model, and what is my degree I define. Third one is, again, you see, explain. The final year management students should be able to explain. I want them to explain. Using what? Using an organogram as per the rubrics provided. I'm giving them the condition, I'm giving them the degree. So then I'm very clear. When for this particular class, I need to have, it could be a lecture method because explain. For that, I need to create an organogram. So I'm going to demonstrate, I'm going to explain the organogram to them. And I will also tell them how they will be evaluated. That rubrics needs to be ready, and that needs to be explained to the learners. So I'm very clear when my outcomes are defined clearly. I am ready for my class. When it is very clearly stated. Again, should be able to display patience in communicating to the simulated patients effectively. This is how we define the outcomes. So now again, I want you to get back. If the first one is your learning outcome, what teaching learning method will you use? Which teaching learning method you prefer for the first outcome? Are you all there? Am I audible?
Yes, sir.
Yes, sir, you're audible.
Yeah, which teaching learning method? What will be your teaching learning method? No? No one? Will a lecture method? Can we use the lecture method for the first learning outcome method? Can we?
So, I have a feeling that the learning outcomes are going to be written by the participants.
Yeah.
So they are going to come up with what is it that they are going to achieve at the end of that learning.
Yeah.
So then why is there a question of teaching method?
No, but now I want, after this session, I want my participants to write learning outcomes.
Okay.
So for example, this session.
Okay.
Are you getting? So my objective
Yes,
is,
yes.
yeah.
Yes, now I got you what you're intending to ask.
How can we facilitate this?
Yeah, the learning outcomes as such can be through lecture method or a discussion method.
Okay. Good. Pardon?
We are also testing the application over here because we are saying that they have to write it correctly. So maybe the application of writing the outcomes is also seen. So is it also a higher level of cognitive knowledge that we are assessing?
we can train them by using a small group discussions, isn't it? A lecture method to introduce learning outcomes, and then we can divide them into the groups, and then we can give them more examples, and we can ask them to discuss in the group, and then we can provide them the worksheet so that they will be able to write the learning outcomes. Before that, we need to introduce the concepts of learning outcomes. Okay, so once the outcome is defined as you rightly said, so we will be able to select the teaching methods. So what about the second one? Which would be the ideal teaching learning method to achieve this outcome?
Demonstration, written demonstration.
Demonstration, very good. Yeah, demonstration, fine. The third one? I want them to explain at the end of the session. So what could be the teaching learning method?
Seminar, panel discussion.
Good. Seminar, panel discussion, lecture. Very good. Fine. The last one. I want them to display patience.
The demonstration or role plays.
Very good. Demonstration or role plays. Beautiful. You see, that's what when we define the outcomes, it's very easy for us to identify the teaching learning method. That could be easily mapped. Again, similar way for the assessment. What is expected out of it? If you see again, you put back the first one, how can we assess? We can give them the worksheet and we can ask them to write. The second one, you can use your ASPIs. The third one again, you can ask them to explain a short essay. The fourth one again, you can ask them to demonstrate, isn't it? So we will be able to define the teaching methods and the assessment methods. Now you see the first one belongs to which domain predominantly? Which domain? The first one, the predominantly. We expect them to write. Which domain is that?
Cognitive.
Very good. Beautiful. The second one, knowledge. The second one. The second one.
Psychomotor.
Skills.
Psychomotor.
Yes. The last one is the attitude. You see, that's how as per the domain we define, and then we will be able to prepare the teaching learning method and assessment method. Fine. So the program outcomes, course outcomes, and specific learning outcomes needs to be defined. Now you see, then this is mapped with the Bloom's taxonomy. Once you define that, you will be able to select the teaching learning methods. If you see this slide, the active learning happens only if you go to the higher level. If your outcomes are only at the low level, define, describe, it's only at the the passive learning. The active learning will happen only if your outcomes are at the analyze, define, and create and evaluate level. So when you define the outcomes, you need to consider that as per the Bloom's taxonomy or Mailer's topic. You see now, by the end of the course, the student will be able to describe aseptic techniques used in nursing to prevent infection. I want them to describe. Describe is the low level, cognitive level 1 or 2. So I want them to describe. If you see step 1, determine the Bloom's taxonomy level. So the CLO is the Bloom's taxonomy level, cognitive level 2. It can also be there. You can go to the nose out level, and you can also take it to the next level. And then step 2, which learning domain you want? You want more to be cognitive? Yes, it is cognitive. If you want to go to a psychomotor domain, and then your teaching method will be different, and then you will change the word from describe. But I want them to describe, so that's predominantly cognitive. Similar way, by the end of the course, the student will be able to describe aseptic techniques. You see, the teaching methods. I can see the lecture demonstration method, and the assessment method. It could be a MCQs. If I'm changing that into a cognitive domain, then I will be going for a practical. So how I define my course outcomes is based on that. So again, another example. By the end of the session, this is specific learning outcome. The students will be able to describe asepsis technique used in the nursing to prevent infection. So teaching learning method. So this will be mapped with your course outcome. So what is your course outcome? You define the course outcome. This specific learning outcome will be mapped with your course outcome. Course outcome 1 and 2 and 3. Earlier we saw how we are mapping the course outcome with the program outcome. So that's what we constructively align. For your constructive alignment, defining your outcomes is important. Again, you see, by the end of the session, the student will be able to perform manual muscle testing using MRC scale. So here, I will go for practical directly, but before going for practical, I also need to give them what is manual muscle testing. You know, this is a course outcome. This is not specific. This is a broader course outcome. You know, it's a course outcome. It's a very broader. And then I will divide them into the muscles of upper limb, muscles of lower limb. All those things I can define, and then that becomes a module outcome. So for these things, I need to have a bit of lecture tutorial. They need to understand the theory, knows how, and then they go for shows how. So my cognitive assessment, I can go any of these methods, and then for my practical, I'll go for ASCII. You know, that's how the defining the outcomes, the levels of outcomes. Again, you see, by the end of this course, the students will be able to communicate the findings of evidence appraisal, both verbally and written. So that's a course outcome. So probably I could map with this my program outcome one. This is a course outcome broader. I want them to communicate. So communicate is again, you know, how both verbally and written. So my teaching method would be a case discussion, or I could go with a workshop. How I'm going to assess, because this is again communicate both verbally, so unwritten. The written communication can be assessed by assignment. The verbal communication can be assessed by presentation. So now this is again mapped with my program outcome. So this course outcome is mapped with my program outcome. This course outcome further I will divide into the specific learning outcomes. So that's how, you know, this is one of what I saw, you know, you have one of the very well prescribed curriculum. You have all these things defined in your curriculum. That's very nice to see. You know, you have all these things. You see, like it's beautifully done. You know, describe the anatomical terms, explain the general and microscopic structures, identify the relative positions. You know, it's very clearly given. If it is very clearly given, now you can easily map. When I say describe the anatomical term, it's only the nose level. That's a Miller-Previtt. Explain, it goes to the nose-how level. Identify, it goes to the up to the shows-how level. Explore, shows-how level. Apply, knows-how. You see, you will be able to easily map. This is again taken from your curriculum. So that's how your course outcomes. It's very specifically defined. So this course outcomes will be mapped with your program outcome. So there it becomes, basically with the clinical. So that's how the module outcome. You see, define the terms relative to the anatomical position, describe the anatomical planes, define and describe the terms used to describe movements. It's there in your curriculum. It is also mapped. You know, you will be able to easily pick up the teaching learning methods and assessment methods once you define the outcome. So the program outcome is defined, and that's mapped with the course outcome. Then you go to specific learning outcomes, and then you go to teaching learning method, and then the assessment method. You may see the pictures there. You know, usually we conduct this as a whole day workshop. You know, that's what when you see after this, there will be a group activity. Since we have a short session, and then just we are going with a PowerPoint presentation only. Then we will be having developing program outcomes, course outcomes, and then we will be mapping. So once your learning outcomes are defined, you know, then again we have plenty of teaching learning methods. You know, which one you are good at. We need to know advantages and disadvantages of each method, and we need to master the methods, and whichever we are comfortable, we should be able to pick that. For knowledge, for practical skills, you will see there are various methods are available there. And then once your learning outcomes, again, the learning outcomes is mapped with the assessment methods. If your learning outcomes is focusing mainly on critical thinking and problem solving, you will go for the green one, whatever the assessment methods are given. These things are available elsewhere. You should be familiar with each and every method, and then you will be using the method where you are comfortable in that. But for everything, defining the outcomes becomes important. So this is one of our course, what we teach. Once I discuss learning outcome, these are all the course outcomes. If you see on the learning outcomes described, we also go with the this purely a cognitive course, knows how. You see that how it is. Understand. We also give percentage for that. What I want. Since when they go higher, you see. It goes up to the level of evaluate. We cannot go to create in this course because it's an undergraduate course, and you see most of our 45% for analyze and evaluate and apply and understand. This is what the blueprint. You may be having some of the sessions later. The blueprint also prepared based on the outcomes what you are defining. So once we define, again the blueprint, the course outcomes are defined. Again, you will see how you will plan your assessment. And then you will be able to see how it is mapped. This is one of the thing, level of attainment. When we analyzed some of the semesters, the course outcome, level 1, more than 80% of the, score, 28 students scored more than 80%, the level 1 attainment, more than 80%. Level 2, 60 to 80, level 3, less than 60. This is how we analyze. If you see again, when we go to the higher level, appraise the evidence, you see the number is all going towards the level 1 and 2. When the outcomes are low level, you see the percentage is more, the high level. That's how the defining outcomes will help you in mapping. That's how the blueprint go on. So the curriculum based on this, that's what we see. The defining the outcomes is very important. To summarize, outcome-based curriculum improves the graduate outcome. There is no doubt, there is plenty of evidence. So define the outcomes. Now what we understood, the program outcomes are broad. From the program outcomes, map with the course outcomes. Then you proceed with the specific learning outcome. The outcome-based education provides the opportunity. It's a student-centered approach. It's very good for the learners. They could achieve the learning outcome. Here, the teacher becomes a facilitator, not the traditional teacher. The teacher becomes the facilitator. This is assessment driven. It's very important. Today, we saw just today about the outcome, but based on the outcome, we'll plan the assessment because outcome-based education is assessment driven. So that's from me for today's outcomes defining. So I open it for discussions. If anything you would like to ask. Anything would you like to discuss? Would you like to share any of your practices? That would be great. Any questions? There's only 2 reasons, no questions. One, we got everything, and then second one, no, we all slept.
Hello.
Understand everything. Yes, Dr. Shailesh, please go ahead.
So, as you explained, every institution has a vision mission that will be reflecting on POCOs through their, right? So, we are adopting the Indian Nursing Council syllabus. So, is automatically POCOs is very standard for all the institution across the India.
Yeah.
So, how it is to be differ based on vision and mission?
Somehow if you see the graduate attributes, if you define that by and large, it will go and fall with the national mission.
Okay.
So we will be able to map that, by and large, the core competencies are common across the practice, isn't it?
I agree.
That's how it is different. One other thing, what we need to see, the councils are prescribed as the basic level. If you're a progressive university, you can go above that. It's a minimal level. You can go above that.
Okay. We can add on that, but it is a minimum standard which every nursing institution has to adopt as a POCOs, or they have to be a vision mission very standard format.
Yeah. So you can go above the standard one, the basic one prescribed. That's what some of the progressive universities are doing.
It's a really very informative session because we long-termly feel about that. That is a POCOs area is lacking in a syllabus, which is not at all clear. And objective only gives competencies, gives how to fit. As like our university, we are struggling with that. But with your kind inputs, it's really fruitful for joining.
Thank you. Usually, once we faculties are trained, and we will be able to take it further. That's what because the fundamental is that we have to follow this accreditation and all. If we understand the fundamental, we will know why there is a vision, why the graduate attributes are defined, and then it will be, we are in the right direction. In another 5 years, Indian higher education is going to be
I'm also the authority for that. Thank you.
Thank you, sir. Thank you. Yeah.
Thank you so much, sir, for your insightful and innovative presentation. Dear delegates, if you have any doubts, you can type in the chat box. Thank you so much, sir, for your insightful and innovative presentation. Dear delegates, if you have any doubts, you can type in the chat box.
Ma'am, will the slides be shared to us?
Yeah, I will pass it on to the organizers. They will be able to share with you.
Thank you, sir.
Sure, sure. Yeah.
Sure, ma'am, we will share you the slides. There is no doubt, so we can proceed further. Can I proceed?
Yes, madam. If no doubts, please. Yeah.
Yes. Feeling gratitude and not expressing it, it is like wrapping a present and not giving it. Hence, I request Mrs. Kartika Tutor VM Con to express our gratitude on behalf of Vinayaga Missions College of Nursing. Gratitude is not only the greatest of riches, but the parent of all the others. A warm good afternoon to one and all gathered here. On behalf of Vinayaga Mission College of Nursing, Puducherry, I feel much privileged to propose a vote of thanks on this auspicious occasion. First of all, I am thankful to God Almighty for giving us courage and strength to arrange this event. His blessing has turned this event into grand success. I express my deep sense of gratitude to our esteemed guest speaker, Dr. Narasimhan Swaminathan, Professor in Physiotherapy, Principal, Faculty of Allied Health Sciences, Sri Ramachandra Institute of Higher Education and Research, Chennai, for sparing his precious time and consenting to be the guest speaker. I thank you for the innovative presentation, sir. I would like to extend my heartfelt gratitude, Dr. Rakesh Shehal, Dean AVMCH, Puducherry, for sharing with us your words of wisdom, sir. Thank you, sir. A special thanks to our beloved Principal Ma'am, Dr. Sharada Ramesh, VMCon Puducherry, for her constant support and encouraging words to make this event as a grand success. I thank you, ma'am. I like to express our sincere thanks to our Vice Principal Ma'am, Dr. V. Sasi, VMCon Puducherry, for who graced us with her presence and guidance. I thank you, ma'am. I also would like to acknowledge my gratitude to our organizing secretary, Dr. A. Samundeshwari ma'am and Mrs. Maheshwari ma'am, for continuous support and motivation and guidance to arrange this faculty development program. I thank you, ma'am. I would like to place my hearty thanks to all the professors, associate professor, assistant professor, lecturers, and tutors for their presence to grace this occasion. I thank you, ma'ams and sirs. I would like to thank all the non-teaching staffs and technical support teams and volunteers for their time, help, and cooperation. We thank you all. Once again, I thank everyone for being here with us today to make this event grand success. Thank you, ma'am. Dear delegates, the feedback link is shared in the chat box. Please submit your feedback soon. It is mandatory to submit your feedback. Please submit your feedback soon as possible. Please do it. I apologize for the inconvenience created today. We assure you that it will not happen in the upcoming sessions. I hope you all have enjoyed today's session. So success is a journey, not a destination. I hope you all will join this journey with us. Let us meet on November 15th on the next session. The details pertaining to it will be shared in the WhatsApp group shortly. Thank you all. The feedback link, it will expire within 30 minutes. Please ensure that you complete your feedback and you submit it. We'll also share it in the WhatsApp group. Dear delegates, you can leave the meeting once you submit your feedback form.